Welcome everyone to this evening's program, Starting a Private Practice. I'm Meredith Apfelbaum, Assistant Dean of Students at William James College. And part of my role is to create career development programming for our students and alumni, hence tonight's career-related panel. Before I introduce our amazing panel moderator, I have three quick items. One, please note that we are recording tonight's program to share with those that were unable to join us live tonight. And two, I want to publicly thank my terrific colleague who I see in the Zoom squares, Lynn Alberding, our Assistant Director of Alumni Relations and Annual Giving, for helping to promote tonight's program. And that's why we see so many wonderful alumni faces with us here tonight. And three, please note that we will have about 10 to 15 minutes toward the end of our program to take some questions from our audience. So please hold your questions until we complete the moderated portion of our program. And with that, I would now like to hand the virtual floor over to my wonderful colleague, Dr. Susan Powell, who is a professor in the Counseling and Behavioral Health Department here at William James College. Susan.
Thank you, Meredith. I also consider you a wonderful colleague, so I always enjoy doing these panel presentations with you. I just want to welcome everybody. I said earlier, I see some names of people that I haven't seen in quite some time, some alums, so it's nice to see people showing up to hear our panelists talk tonight. We're going to start off, I'm just going to introduce who they are, and then they're going to tell you a little bit more about themselves, and then we have a series of questions that I will pose to them that they'll respond to, and then as Meredith said, we'll have time at the end for you guys to ask questions if you'd like. But joining us tonight is Emily Kossowsky, Leah Kamin, Deven Mavani, Nicole, Issa, and Gureen Singh. I will ask Emily to start us off if you don't mind, and just tell us a bit about yourself, how long you've been in private practice, etc.
Thank you, Susan. Hi, everyone. My name is Emily. As Susan said, I am an LMHC. I graduated in 2014, and I have been in private practice since June of last year. And I hope you all leave tonight feeling like this is a doable and rewarding road.
Great. Thank you, Emily. Leah, would you like to go next?
Hi, I'm Leah Kamin, and I'm a psychologist. I actually went to school in Oregon at Pacific University School of Professional Psychology and graduated in 2014 also. And I've been in private practice since spring of 2018. I mostly work with, I always say I specialize in like anxiety and relationship issues, but of course I see the whole spectrum of diagnoses, but I see a lot of like professionals and college and grad students in my practice.
Great, thank you, Leah. Deven?
Hi, everybody. I'm Deven Mavani. I'm an alum of both the counseling program and the PsyD program. And I graduated the PsyD program in 2018, actually. And my start in private practice overlapped actually as my role in a student. I connected with a local neuropsychologist who I trained under for a couple of years. And actually, I didn't start the practice myself. I actually purchased the practice from him. But I was able to redesign the whole practice from kind of like a ground floor up sense. So there was a lot of operations work that went into it. I don't do therapy. Actually, I haven't done therapy since school. I only do neuropsych assessment. My specific areas in neuropsych assessment are in dementia and complex dementias, head injuries, a lot of ADHD, and then some general psych assessment that's been coming out a little bit more in the last couple of years.
Great. Thank you, Deven. Nicole?
Thank you. Hi, everyone. My name is Nicole Issa. I am a licensed clinical psychologist, class of MSPP 2012, and I co-own a group practice. We have a total of 13 clinicians in Providence, Rhode Island.
Great. And for those of you who don't know, William James College used to be MSPP, Massachusetts School of Professional Psychology. So it took some of us a long time to get used to saying WJC and not MSPP. So thanks, Nicole. Gureen?
Yes. Yes, I would second that. Hi, everyone. My name is Gureen Singh. I also graduated MSPP/William James because the transition happened while I was still there in 2013, actually. And I graduated with a master's in counseling psychology program, currently practicing as an LMHC, which I got in 2015. I started my own private practice in 2017. And currently also have a group practice that I'm running called Collaborative Insight Counseling Associates, or SICA, and that's been running since 2018.
Great. Thank you, Gureen. So I'm going to start now with posing questions to the panel, and panelists, you can jump in whenever you want if you want to respond to a question. I think everybody will respond to this first question, which is, why did you decide to pursue private practice? And did you initially start out part-time or full-time?
I can go first.
Yeah, go ahead, Nicole.
So I did my postdoc in a private practice, and then I started out actually in Cambridge part-time, and then very quickly filled up, and then went full-time probably within 3 months.
Great. What made you decide to do private practice?
Well, being at the postdoc, I really liked the flexibility, making my own schedule, you know, working when I wanted and seeing the type of clients that I wanted to see. And I could really hone in on what I wanted to learn more about or specialize in. And then when I went off on my own, I just realized that I liked being my own boss. So
Here we are. Yeah.
right, here we are.
Yes, great. Emily, you're unmuted. Do you want to go ahead?
Sure. Yes, I was motivated by the autonomy and the sense of control that you can have over the vibes of your practice and what it means to you and the kind of clientele that you'd like to attract. I took 2 years to work with a large group practice, and that gave me a nice amount of time to develop a sense of security. And at that point, I was able to transition to my own thing. So that autonomy and honestly, a more livable income, a better income when you're on your own as well. Those are my main motivations.
Yes, great. And we'll talk more about some of those issues you raised as well. Yeah.
My path is pretty similar to Emily's. I always planned to be in private practice, but I worked at a large group practice for about 2.5 years after grad school. Just it seemed too scary to start out on your own with all the student loans and everything ready to be paid back. So, and yeah, I worked really hard there, and some of the values of the company were more around making money than necessarily patient care, which would come up with things like cancellation fees or whatever. And so I think there was value to getting that like really drilled in the beginning. But ultimately, I much prefer the autonomy, and it is better money than working somewhere else, and just the flexibility and yeah, getting to have your own vibe of your practice, like Nicole said.
Great. Thank you, Leah.
Yeah, just to continue on that, I've always had a capitalist and entrepreneurial bug in me that I've always wanted to kind of expand upon. So it was always the long-term goal for me. And I think that, just as everyone said, the income potential was definitely far greater in a private setting than anywhere else. My experiences and internships and kind of being at the bottom rung of the ladder really pushed me forward to appreciating the autonomy that comes with a private practice as well. And I think that that for me has the highest value to it.
Thanks, Deven. Gureen, how about you?
Yeah, just want to echo what everybody else is saying and add an extra point here about, you know, the kind of change that you're able to make when you're doing your own private practice is very different than even if you're, you know, kind of in leadership positions in other organizations. I was working in a community mental health setting, and even though I was a supervisor there and at the director level, it was hard to make some of those changes changes that I knew would help with patient care and with policies, and not being able to do that is really what drove me to starting my own private practice and creating policies that just worked, that I knew made sense, and not having my own bosses. Being my own boss and not having a boss is actually really great as well. So
Great. So a lot of common themes about
yes.
your motivations for all of you to start a practice. I wonder if each of you can speak a bit about how you get clients and referrals, and how long it took you to build your practice to where it is now. And just jump in whenever you want, panelists.
I left a company that I was working for, and they don't have a non-compete, which I think is illegal in Massachusetts, but I do think some places do them. But so I essentially started my practice with 30 people coming with me. So it was very easy to get started in that way. I had a full caseload the first week, but I would say it's a bigger challenge for me to keep up with responding to patient inquiries. That's like one of my stressors in private practice. I think I have 45 unread emails right now, because I'm sometimes a delinquent with responding to potential patients. And so I would imagine that there's little risk with being able to fill a caseload for most people, depending, I guess, how specialized you might be. I'm pretty generalized, so I probably appeal to a lot of people in that way. But yeah, there's a high demand for therapy, and I think that's only going to grow. Therapy is really popular with Gen Z and millennials, but Gen Z is really into therapy, I think. So I feel like it's only going to continue to be high demand.
I agree.
Absolutely. I will completely second all of that. It took, as I said earlier, transition from a group practice. There was a non-compete, but I consulted someone I know that was able to give me advice on that. And I was very reassured that in Massachusetts, there were very ethical and safe ways to take your clients with you if that's what they want. And then in addition to that, I use Psychology Today, which is extremely reasonable. I think it's like, oh gosh, I can't remember if it's 25 or 40 a month. Someone probably
30.
Okay, neither. So it's and that I have in big capital letters, unfortunately, that I'm not taking any new clients, and you still will get inquiries. But I also agree, just would not be a concern unless you're highly specialized.
Great, thanks, Emily.
Yeah, I'll just add that, so for me, it was a little bit different because I wasn't sure if I wanted to actually go into private practice full time, or that even if I'd be able to sustain that as my sole income. And so I actually started private practice part-time while I was working as a temporary counselor at Mass College of Pharmacy. And so because they needed a temporary counselor and it was a sure shot way of paying bills at the time, I decided to supplement that with starting my own private practice, and would just see clients once a week, 1 day a week, and slowly grew that practice over time, and realized that there's a huge need for folks wanting therapy, especially wanting therapy with a woman of color. And so it was a need that I hadn't quite realized was in the community before actually starting my private practice. And once I realized that folks were coming in for that specific kind of need, it really just kind of catapulted the rest of the journey. And by that summer, I had left MCP because that was a temporary position anyway, and then had started private practice full time. And Psychology Today, definitely still a referral source that brings in the most clients. So, yeah.
Great. Nicole,
Yeah, I would echo that. I mean, I think the whole reason, I teamed up with another psychologist and we started a group was that we were inundated with referrals, and we liked the idea of having a team. So, you know, I definitely think, and especially since COVID, no one will have any issues finding clients. So,
Oh, Deven, you're muted.
Sorry about that. So as a testing psychologist, I recommend psychotherapy all the time. Like I would definitely over 50% of the time, especially to my younger folks. So like in just the amount of what a big change I saw was pre-COVID versus now is that, you know, the bigger issue is for patients trying to find therapists. I mean, I was having conversations with 3 people that I just saw today. And that's been a stark change. And the amount of people, like if I had like a therapist nearby that just started from scratch, I'm confident in 1 to 2 months I'd have your caseload full. Like it's just that much of a demand just from like my little area. So yeah, just kind of like what other people are saying, I don't think that you'd have an issue. I think the issue would be more like, are you going to be able to manage the amount of referrals that you're likely going to get?
Great. Thank you all. Yeah, I wonder if each of you can talk about what was involved for you in getting on insurance panels, if you still are on panels and take insurance, and the fee structure for 45 minutes versus 60 minutes, and anything you can share about your interactions related to dealing with insurance.
I could actually start off with that. I'm on almost every single panel that's offered by the Commonwealth. That's in the Commonwealth. That's just kind of some perspective that I wanted to take, or part of the business model. Frankly, one of the common themes that we've heard a lot of people that call our office would be that, you know, I can't find anybody that takes my insurance for neuropsych testing. Some new insurances that came over to our side, kind of like Cigna, that kind of became more popular in the last year or so. Nobody was taking them. I jumped on that panel right away as soon as I got licensed. So I decided to go that route, and obviously that's been resulted in a lot of high volume. I think that what's made it work is that as I was involved in the practice before I bought it, and then of course after I bought it, we've had a billing company, and that we outsource all of our billing to, all of our insurance benefits to, and they sort of handle all of that part about payment processing, deductibles, all that type of stuff. And my full-time office manager liaisons with them and deals with all the kind of like the individual issues that are likely to come up. No billing company is ever perfect, but we've worked with them for a long time, and they're actually national, but they're based in North Reading right here in Mass. So they're familiar with our area too, which is just an added benefit. But I think that without having a solid billing company, I can't even imagine how it would be possible to manage all the different like claims and things like that. So I think that would essentially be crucial. As far as getting onto them, I would say the range, some insurance panels work quicker than others. I'd say Blue Cross probably worked the quickest, and they're the ones that I would say second or about equitable volume to Medicare. Medicare, I think, took a little bit longer, 2-3 months, and then I would say the longest one I think was like Tufts and Optum for Harvard Pilgrim and all that. So that one took like about 6 months on the longest end. So if we're talking about a range, if you were going to go for every panel like me, you know, I would expect anywhere between 2 months at least to about 6 to even maybe 8 months, just to be on the conservative side, just to be able to get on that panel and get all the paperwork processed and all that. I recommend getting a credentialing company to do that. It is a bit of an expense. I think it's a certain flat fee for each of them, depending on the company you go with, but you fill out one thing and they end up doing all of the legwork, and that you don't ever have to deal with it again after that, because all you have to do is sign off on the contract at the end. And then all that kind of annoying setup work is done. But I didn't use them for all of them. I did it for most of them. The process wasn't too hard at all, but I think that's something that I would definitely recommend. My fee structure would be a little bit different because I built primarily testing codes, but I think my colleagues would be able to speak better to the fee schedules.
I'm just going to, Denise, ask a question. What do you mean by get on that panel?
Oh, so to get on the panel means that you're able to accept that insurance carrier for payment. So to get on a panel means to get on Blue Cross Blue Shield's panel. Once I'm on the panel, so to say, I'm able to accept a patient's insurance, and that's essentially what that means.
And you have to fill out an application to get
Yeah.
on that panel.
Exactly, exactly.
Great, great. Thank you, Deven.
Mhm.
Others of you want to respond to that?
I
Sure.
can say a little. Oh, yeah, you want to go?
I think, sure, because I have a bit of a different story, I think I'll offer maybe just a bit of a different perspective with that one. Because I came from a group practice that had done the legwork for me, personally, that was another benefit of going from group practice to my own situation, because I was able to essentially just update the information that they had already provided, and they had already gotten me on the panels. So there's something called, I know the acronym, I forget exactly what it's called. One of my colleagues might be able, the CAQH.
CAQH.
Thank you,
ProView.
yes. Yes, ProView, yes. So you fill all your information out in there, and all the insurance companies can access it on that. So one piece of advice I have is, for each insurance company that you wish to be credentialed with, get the best contact info you can and keep track, so that you don't have to every time hunt down who the best person is to talk to with credentialing, because for any given insurance company, there are several numbers and point people. I can give you I did look up for LMHC is the exact rates actually for me right now. And I take Blue Cross Blue Shield, Tufts, Harvard, Pilgrim. I won't go on, but a handful of those. So for the 60-minute sessions, the lowest reimbursement is $109.46, and the highest is $132.09. For 45-minute sessions, the lowest is $73.16, and the highest is $89.47. So something to keep in mind, that these rates do vary. And as you're building your practice, something we didn't mention earlier was that the intake sessions, you get reimbursed at a higher rate. So there is some cushioning there as you're starting out and building your caseload. You get those higher reimbursement rates as well. I think that was a little zigzaggy, but I think those are all my credentialing
That's
points.
great. That's great. Thanks, Emily. Gureen, did you want to say something?
Yeah, I want to kind of take it back a little bit to kind of explain a little bit more about the paneling process, because I know it was really confusing when I first started it. So there are two pieces to it, really, depending on whatever panels you want to get on. There's a credentialing process and there's a contracting process. The credentialing process is what my colleagues were saying earlier, which is the CAQH or ProView, which is one application. It is a long and tedious application. Take your time with it. It is, if it makes you want to throw away your laptop, that is normal. So that is a really long application that all insurance companies have access to. And then the contracting piece is more specific to the insurance company that you want to get on the panel for, like Deven was explaining. So for Blue Cross Blue Shield, that contracting application looks a little bit different. You get in touch with with the contracting department, and you can call them and hound them. I've done this before, which magically seems to speed up their process. But regardless, it definitely took about 2 months to get on Blue Cross Blue Shield's panel. That is the only one that I am on as well. The other insurance companies I accept out of network, which there are some practices that will give the clients a super bill, which is essentially a bill of all of the services that they have had with the therapist, and then the client can go to the insurance company to get some reimbursement from. And then there are other practices that will still submit claims on the client's behalf and kind of duke it out with the insurance companies to see how much they'll give, and then we'll balance bill. This is like terminology for billing, balance bill the rest to the client. There are some people who are really savvy with this billing stuff. There are other people who absolutely hate it. So if you are one of those people who can handle it and have the bandwidth, honestly, because it can take time to stay on the phone with insurance companies, figuring out some of these pieces, great. I know that another recommendation was also to get a billing company and to outsource that. Also a great idea. So just wanted to add some pieces there about that process.
Thanks, Gureen.
Yeah, and I would just add, there are my path has been a little bit different. When I started out, I took a lot of insurances, and then one by one, I started coming off the panels. And now I see, a lot of people in our group see a lot of folks with insurance, but I do a lot of coaching on executive coaching. I'm still licensed in Mass and New York. So I see, folks from some Fortune 500 companies, and I'm able to bill, 300 plus an hour for those visits. So I think there's ways, whether you go fully private pay or you sort of do a hybrid model to make more money, either to stay on insurance or to get off insurance. So that's all I did.
Great. Thanks, Nicole. I wonder if you guys can speak a bit about if you have any tips for sort of financially managing your practice, what's involved in that, things like startup costs or keeping your overhead costs low. Anything anybody wants to chime in about that?
Well, I think now, right, you could, with everything being online, you could really have minimal overhead. I'd recommend like Psych Today. ZenCare is another website that we found really helpful. That's for therapists marketing. You could start up purely online. I do think it's helpful to actually have a physical address. I've noticed, clients, even if they are going to see you online, they still sort of look to see, like, are you near me? Where are you? But I think it could be minimal. I know when I started, I had saved a bit of money to, have to make sure I had enough for the rent and materials that I needed. And so I'd recommend, figuring out what you need and what your plans are.
Mm-hmm. Somebody asked, can you be on a panel without a physical address? I thought some insurance companies do require you to have a physical address, or they won't.
And I personally wouldn't want to put my home address on the insurance, because I think people can look up my address on Blue Cross. So I have a mailbox at the UPS store across the street from my house. So that's my business address, and it's it's kind of expensive. If you don't tell them you're a business, I think it is much cheaper. They know I'm a business. So I think it was like $900 for the year. But it's also nice because then I don't get packages stolen off my stoop in the city. I think if doing something like Simple Practice makes everything pretty easy. They're not the most user-friendly in all ways, but getting a kind of software that submits claims and does the scheduling, and you also do telehealth through it, paperwork, all of it is done, the medical record is all on it. It makes everything pretty simple. That's like $60 a month, I think. It maybe just went up to include the telehealth. I built a website. I thought that was important. A lot of people don't have websites. I do get a lot of patient inquiries through my website. And yeah, you have to register your business. I have my dad's a tax attorney, so that made a lot of things easier. I think if you have someone who knows at least or can help you with your taxes, that's probably I don't think I would have been able to do that on my own, but billing and things like that, I feel totally able to do, especially with the software.
I use something really similar. I use Therapy Notes, which is just a wonderful platform. I was a bit insecure about handling the finances, but the customer support through Therapy Notes has been so helpful, and I really found that it's manageable. For me, I have I see about, I'd say, 25 to 30 adults a week, all virtual. So I've been able to maintain that. Now, I did hire a professional for taxes, which I would echo that as well. I would recommend that, just that little security blanket that it's all done correctly. And having a completely separate business account, business card, and paying your estimated taxes is
Yeah, the
a
quarterly
recommendation as well. You will not maybe emotionally, and you have to use your coping skills when you submit that payment, but it's a good thing to do. And what else? Just keep track of spending, of course, like you would guess.
Yeah, for deductions, you mean your expenses?
Yes, exactly. Yeah. Thanks.
Yeah, and I would say my biggest startup costs were all like, furniture shopping for my office because I was all excited about decorating it. And I actually got like a Chase Business credit card, and I got that like the minute I got the LLC filed. And so because then you have you need a tax ID and EIN. And then was able to like furnish my office with that and pay it back pretty quickly. I think it was like no interest for a year or something like that.
From a testing perspective, a little bit unique and a little bit more traditionalist, I would say, and unfortunately, a lot more expensive too as well. One of the things the pandemic did is obviously testing is not something that, actually I know a lot of people did go to testing virtually. It's not something that I was actually, very supportive of, because these tests were never designed to be administered in a telehealth format. And to me, that compromised standardization, that compromised administration. And I didn't want to compromise the integrity of how these tests were developed, because the second you mess with that, you put a big asterisk on all of the data. And so instead of that, I shut down actually for 2 months and then reopened in person in like May, early June, kind of like when the first phase of opening up started. Theoretically, I was always allowed to stay open, but for safety reasons, I still just stayed closed for 2.5 months. And then since then, just fully in person. I do telehealth for like certain intakes and then for certain feedbacks, but primarily everybody that I see is in person, including intakes and including feedback. The feedback from patients that I've gotten is they actually appreciate being able to come in person. But so I would say like 5% of my intakes and feedback are actually telehealth. The rest are in person. For a testing practice, you need a lot more space. If you're doing a high volume practice, you need staff for it. There are psychologists that I know, colleagues like in the area, that do kind of everything: administration, the test administration themselves, and then the report writing. It's certainly not the model I follow. So I have a full-time office manager, I have a full-time testing technician, and I have 1 to 2 interns at any given time to just kind of as a training opportunity. So office space wise, obviously you would need your own office. You would need a dedicated office for test administration. You would need, if you have a full-time staff, you would need a separate office for that person to be able to do that work, scoring and all that stuff, and then a solid space for your office manager. My clients, I should say, my referring providers are all physicians. So 95% of people I interact with, or the patients that come to me, are coming from physicians. So physicians work a lot with fax and all that stuff. So I have to have a digital fax operation going. We're dealing with medical records all the time. I'm seeing MRI reports and things like that. Some of it comes through paper. So I do have like a laser printer with a toner that I have to replace every year. That's upwards to probably the amount that and we've cut down on printing, but it's anywhere between just 1,000 to 2,000. Probably say more like 2,000 to 3,000 per year just on toner, and that's after reduction. And if you're going the testing route, I mean, being really strong with organization is an absolute must, and reducing your paperwork, just environmental issues aside, just in the interest of organization, is crucial, because once you get things a lot cluttered and all over the place, it can be very easily overwhelming. So investing in a scanner that digitally takes everything and puts it into an electronic health record is going to be one expense just right there. And then the test materials itself, they add up. So I think the one thing about testing is that if you're really, really niche focused and only do personality, then even that's going to still be a recurring expense. Because if you do a PAI, that's going to cost $5, I think, per administration, and then 20 to 25 for the interpretive report, just to assist with that. And if you're doing 5 of those a week, that's already 125 right there. That's not something I specialize in, but of course, going into neurocognitive stuff, there's a tons and tons of tests. And when a new test comes out, you're going to want that. It's going to be really interesting. I want to see how that plays out in my evals. Everything's going to add up. So, and then of course, just test administration materials and all that type of stuff. It does definitely add up. My office space is about 11 to 1,300 square feet total. So includes a waiting area and all of that, an employee break area. Getting too small just based on our volume and my ideas for expansion. So there's a ton of referral volume for testing, but if that's something that anyone plans to do solely, that's something to keep in mind right when you're starting, is that you're going to need a decent space and a decent amount of startup cost.
Okay. Gureen, did you want to say something? I saw
Yeah.
that
Yes, I wanted to add kind of different perspectives in terms of a solo practice or group practice. So in the solo practice, I think that the costs maybe are not as high as based on everybody is saying, where, you know, really you're trying to just set up your EIN, which is kind of a business version of your social security number, so that you're not sharing your social with everyone. It's something that you apply for, it's free. And then, you know, business account, your overhead in terms of your lease once we're back in person, or an address like Leah was mentioning, and furniture, and just kind of doing that piece in addition to your EMR software and your phone and all of those expenses that you're going to need to keep the business running. The group practice piece is a little bit more complex, where it has some of the expenses that Deven was mentioning. One of the things that I found really helpful for the group practice is using QuickBooks Online. It's a great software that connects your bank account directly to the software, where you can go in and kind of categorize your expenses. So throughout the year, it already has all of those pieces teed up for your accountant. You can have your accountant have access to it. So I guess all of this in saying that even if you are considering the group practice option or a neuropsych testing specific practice, it is doable. It can feel really overwhelming at first, but once you have those right kind of setups and the right team behind your back, I think it's very doable and manageable. For my solo practice, I have a simple Excel spreadsheet that I just use to track expenses, and I have some formulas in there that make sure that I'm not taking too much out as a salary, and I have enough cushion in there for those lovely quarterly tax payments, etc. But, you know, also just even if you're doing a group practice piece, there are softwares out there that will help with that financial piece, and definitely would recommend having a CPA and a good one.
Yeah, I would just echo that, you know, since, you know, I co-own a group too, we use QuickBooks. It makes everything so much easier. Our overhead, we've kept our office, even though most people are sort of working from home or sort of hybrid now. So we've had that expense through the whole pandemic, you know, and as you expand as a group, health insurance, 401k, you know, we provide people with CE reimbursement and, you know, life insurance. So things, you know, if you want to have a group and retain employees, right, part of it is, right, paying them well and then offering them incentives. So I think those expenses can be high, but, you know, if you have a well-run group, it's totally doable.
Great. Thank you, guys. I think I'll pose one more question because we're getting low on time, and then we'll open it up for audience questions. I know Denise had another question that we'll address too. But I'm just curious if you guys could speak a little bit to the rewards and challenges of private practice, anything that stands out to you. I know some of you have talked about liking being your own boss and having that autonomy, but any other things you would add about rewards or challenges?
I would say challenges. I know we've discussed the rewards challenges. That was the biggest challenge for me easily, has been employee retention. My practice is something that is dependent on each member of this team sort of being filled to the level that it is. When I started this, my office manager was, well, not this particular, but in general, the position was part-time. It was probably about anywhere between 20 hours or so a week. Now it's 40 hours a week, but even that seems like it's not enough. it's, that I would say in that position, there's been a bit of a higher turnover rate than I would have expected. And I'm trying to keep up with like how labor has been evolving and increasing pay. And that's obviously one of the bigger things to keeping keeping retention. I think the trouble with that also is that insurance companies don't like to increase the fee rate just as the wage across the country or world increases. So the money still has to come from somewhere. So that's been, of course, troubling on that end. But, I would say retention has been the most difficult part for me specifically, since my practice depends on that.
Yeah, I want to add some other challenges too. So one of the really big challenges of being your own boss and having your own private practice is health insurance. So I am fortunate enough to have a partner who works at MGH and has awesome insurance, and I don't know what we would have done if he didn't. So please have that be part of your kind of equation as you're figuring out if private practice is a good idea for you, because as we all know, costs of health insurance are just continuing to increase in this country. Also, no PTO, no time off. So trying to, balance having not burning out, taking time off, but also not getting paid when you take time off, and building that into your revenue as the year goes on, and allowing yourself to take that time off and knowing that you've budgeted for it would be another kind of challenge to work around. Another one is the fluctuation in income throughout the year, right? So there are definitely certain months that are less busy than others. And again, this is just my anecdotal advice, so to speak. I think March and October, for some reason, seem to be really, really busy. I don't know why. I don't know if it's midterms. I don't know if it's something else is going on, but March and October tend to be really, really busy. And then right around the holidays, it's a little bit slower. So just keeping that in mind as you're going through the year, and I guess not panicking when there are more people canceling or on vacation, etc. I also think that it can be a little bit isolating doing private practice, especially if you're not within a group setting. So definitely seeking out supports in peers, whether it's a peer soup or just reaching out to folks that you know are working out in the community and touching base, can be really helpful. And then, needing to be organized in general. I think the financial pieces that we've just talked about, as well as, client referrals, and at the end of the day, private practice is a business, and knowing some of those business pieces can be really helpful, and being organized in that sense can be really helpful as well.
Anything anybody else wants to add from the panel before we open it for questions? Okay. Meredith, what do you think? We can take a couple of questions?
Yeah, for sure. In fact, I'm not, I apologize. I don't know if you've all answered this one, but Helen had a question a little bit earlier. Do you have recommendations for credentialing companies? I don't know if anybody wants to speak to that.
I can share the one that we use. So it was actually outsourced by my billing company. They work specifically with one credentialing company that inadvertently I worked with, and they're called Lloyd Solutions. They're based in New Jersey, but work everywhere. And that was the one that they sort of have a contract with to do all their credentialing for them. So that's the one that essentially did it all for me.
Thanks, Deven. Anyone else on that one? And then Denise's question, are there particular states that make it easy for licensed psychologists in Massachusetts to have multiple licenses in other states?
I can speak to that a little bit since I'm licensed in 4 states. Rhode Island was really easy actually with a mass license to get licensed. My New York license was probably the most difficult license the process was just, it took almost a year. So that was pretty difficult, but it's totally doable. All the credentials were basically the same. And then I'm also licensed in Florida, which was very easy. with a mass license. So I think, yeah, I think you just have, every state has different regulations and requirements. So I think you just have to pay attention to some of that. And then I know there's legislation. I don't know if you guys are talking about this at school, PsyPAC, where certain states may be making it easier to practice telehealth across state lines. So, you know, I think there's probably more to come on that.
Mhm. I would add too, there's an organization called National Register of Health Service Providers, Psychologists, and you pay like a fee up front and you get credentialed with them. And then it makes it a little easier to get licensed in other states at the doctoral level. At the master's level, it's very complicated. Every state has different requirements. You can get licensed in different states, but yeah, it's just not necessarily easy.
And I usually tell students, if you have a sense for the states you want to get licensed in, go to the end of the process first and work backwards. In other words, go to the board site for the state and literally print out the licensing application and see what do you need to fill out to become licensed in that state, and that will guide you.
Mm-hmm.
Other questions?
I have one for Nicole. Hi, I'm Christy. I'm interested in being licensed in Massachusetts and Florida. So, but I know that Florida requires a postdoc and Massachusetts doesn't. Did you happen to do a postdoc, or is there a certain time frame where if you've been practicing for a few years, you don't need a postdoc in Florida?
Well, I just have a license in Florida in particular to do telehealth. So I did do a postdoc since I was living and working in Boston when I graduated. And I know I could probably go through the process, but if you don't have plans to actually like live in Florida or see patients in Florida, then you could get the telehealth license.
Thank you.
And actually, a question just came in from Kaylee. If a patient cancels their appointment and they use insurance, are you, as the provider, out of your pay that day? Does anyone have cancellation policies to help ensure this does not happen often?
I have a lot to say about that. So the place I worked before had a really strict cancellation policy that was also 2 different prices depending on the time of the cancellation. So if it was less than 48 hours, it was $75. And if it was less than 24 hours, it was $150. And there were basically the only time I was ever able to get them to let me waive the fee was if someone was literally in the hospital, like giving birth, or with pancreatitis, or like literally a hospitalization was the only way I would get that excused. And it caused a lot of anxiety for the patients there. And it kind of reached a culmination for me when it was like, this was January 2018, there was like some big blizzard and we were encouraged to still collect fees if people didn't show up. This is pre-telehealth. And so I was like, I'm not going to work that day. I'm canceling everyone, because I just couldn't like charge everyone $150 for not like traveling in a blizzard. But currently I still have a cancellation policy. I like very much live in the gray area with it, because I personally don't love charging people to not come to therapy. And I don't think it's that great for the relationship or rapport. Probably other people are more business minded than me in this way and would say have a strict one and keep to it. But I tell everyone in like the upfront in the first conversations that I have a cancellation policy. It's $100 if it's less than 24 hours. And I really have it there for people who are kind of repeat offenders. So everyone can have a freebie. And if you're someone who starts having issues with that regularly, then I'm going to charge you for it. It's still really hard for me to do. And I sort of prefer to have a busier schedule and then be relieved when people cancel rather than like have to be stressed about the money because someone didn't show up. But that's me.
Yeah, I have a policy in place that I've sort of expanded on based on how the practice was growing and developing. For patients that no show, we have the typical 24 to 48 hour. I tend to be pretty lenient with that. If someone calls like 10 minutes before the appointment, says my car broke down, I'm not gonna charge that. Like it's, and then some people get sick the night before. We had a couple people that just got tested for COVID. Not gonna charge for that. Rescheduled, and that's totally fine. But I appreciated the fact that it was communicated, even if it was within the 24 hours. It made all the difference. No-shows is a bit of a different story, because testing no-shows are the ones that are bigger for me. So I do charge a $300 fee for that. I also require a credit card on file, which I take at intake. That's what I did do up until a few months ago, when then all of a sudden my intake started just no showing, no phone calls or anything. So because of that, we require now a $100 deposit right up front when you call to make an appointment. I had a lot of anxiety implementing that. I had less anxiety implementing the card required on form, but that worked out completely fine. I had way more anxiety about just requiring $100 just to get your name in the book. Because it's like, would I even want to do something like that? But it's just like the month of June of last year, it was like a really weird thing with so many no-shows that pushed me over the edge with that. Frankly enough, it's only filtered out about 5%, 5 to maybe 8% of all the patients that are making appointments, and everybody 90 to 95% are putting it down. And that deposit fee is fully refunded at the end of their evaluation, which is a little bit different with therapy because you're doing ongoing treatment. Evaluation, 3 appointments, you're done, they get that money back. So a little bit unique to testing, but I'm sure if you're doing like a 12-session treatment program for therapy, if you want to implement it, you can, but it's something that I had to do.
So I too have a late cancellation policy. So mine is 24 hours. Do we get paid from insurance companies if a client cancels or no shows? No, the answer is no. I'm pretty sure that was maybe implied from our answers, but I'm just directly saying we do not get to collect anything from insurance companies if the client cancels or no shows, which is why some of these policies are helpful to have in place. My policy right now is 24 hours, and I do charge my full fee, which is $225 if a client no shows or cancels. I'm also like Leah in that way, where I do live in that gray area a little bit, where everybody gets a freebie, and I think it's a conversation with clients. And if they're repeatedly canceling or no showing, then it's a clinical conversation that needs to be had. But yes, that policy is just helpful to protect our time, honestly. And so it's there for that reason. I also, kind of similar to what Deven was saying, had required credit cards on file for clients, and would charge them at the end of the month if there was any outstanding balances, because I realized that folks just forget to pay their copays, especially when you're having continuous therapy. And so that was one of the policies that I implemented, where at the end of the month, the credit card on file would get charged automatically, and Simple Practice is a way to do that. Auto pay is another great option that folks can also use depending on your EMR and what you're using. But yes, that's what I'd like to say about the cancellation/no-show policy.
Well, thank you, everyone. I'm noting the time. It's exactly 8 o'clock on the nose there. So perhaps Susan, unless you have any closing question or thoughts.
No, I wanted to thank our panelists for giving of your time tonight, and thank all of. Sorry.
Looks like. Do you have time for maybe one of you answer this? I just, one last question just came in. How do you protect credit card data for your clients? One last question for the evening. Anybody want to take that?
I can take this. I know I was talking about credit cards earlier. So the EMR system that I use, Simple Practice, has in it the ability for clients to put in their credit card information, and so it's like part of their client record and is protected by Simple Practice. So unless you go into the system and into your chart, nobody can access that. So it's protected by Simple Practice is what I'll say.
Wonderful.
Great.
Thank you.
Yeah.
Thank you.
Yes, thanks to all of you for being here, giving of your time so generously, and for all of you who have showed up tonight to listen to our panel. And thank you,
Yes.
Meredith, for organizing this.
And thank you, Dr. Susan Powell, for being our esteemed moderator again this year for this panel. And I hope that this has been recorded. The recording will be available, and I hope that you all have a wonderful rest of your Monday night. Thank you.
Yes, thanks, everybody.
Take care.
Take care.
Bye-bye.
Bye, thank you.